I think the 5 most important things a man needs to know regarding recovery from radical prostatectomy are: the most important thing to know after recovery from radical prostatectomy is, once you leave the hospital, what to do with a catheter if something goes wrong. And I think the most important thing men need to know about that catheter is across what's called an anastomosis, or a reconnection of the urinary system. If for some reason something goes wrong with that catheter, only a urologist should be able to manipulate that catheter, change that catheter, remove that catheter, or give you a new catheter. If it's a nurse, if it's an emergency physician, if it's a family physician, if it's another surgeon, you should not let anybody touch that catheter, because if he or she removes that catheter and puts a new one in without knowing there's an anastomosis, that anastomosis can be destroyed, and that can have huge impacts in terms of continence and voiding function after surgery. So if there is anything wrong with that catheter, one should call your surgeon, i.e. urologist that did the surgery. If he or she is unavailable, I think you should go to emergency. And if there's something wrong, then you should tell the emergency nurses and physicians that you would like a urologist to be consulted immediately. The second most important thing in terms of recovering from a radical prostatectomy is regaining control of your bladder. I always tell men that that is probably the most important thing you have to do beyond just the physical recovering from surgery, i.e. pain, wearing your catheter, etc. The faster you learn how to control your bladder, I think the faster you'll recover from surgery, i.e. the more comfortable you'll feel going back to work, the more comfortable you'll feel being intimate. If you're still wearing pads or diapers, intimacy is probably not going to be high on your list of things to do. The best way, I think, to recover bladder function after surgery is actually to see a pelvic floor physiotherapist. And your urologist should have a list of local pelvic floor physiotherapists to help you retrain your pelvic floor, to help you understand better your continence, and help you with proper exercises in terms of trying to regain your bladder control. If you have a coach to help you along, it's much better than doing it by yourself. We have excellent pelvic floor physiotherapists in the Lower Mainland, and most of us have a list of special physiotherapists who have extra training in pelvic floor physiotherapy. The third most important thing about recovering from radical prostatectomy is what to do with your catheter once you've left the hospital. And most men have never worn a catheter before. The catheter is that tube that basically is placed in your penis that goes into your bladder and basically allows urine to drip into a bag on your leg, or a big bag at nighttime. And learning about that catheter either by talking to the urologist, asking the urologist for a pamphlet regarding catheter care, asking the nurse who you see in the preoperative clinic, asking the nurse on the ward to teach you how to use that catheter. And basically, I think it's a very simple thing. The catheter doesn't require any special treatment other than just some soap and water to clean it. You need to learn how to connect the bag to the tube. You need to learn how to empty the bag into the toilet bowl. But I think that learning how to use that catheter after surgery, and the catheter only stays for sometimes 7 days, sometimes 14 days, and the rare case is 3 weeks. It's only a temporary thing, but the more comfortable you are with using that catheter, the faster you'll get on the road to recovery. The fourth most important thing in terms of recovering from radical prostatectomy is the wounds. If you are having an open prostatectomy, you'll have an incision from your belly button down to your pubic bone, and most of the time surgeons will either put staples or absorbable sutures. If the sutures are absorbable, then you don't have to worry in terms of having them removed. The surgeon should tell you what was used. If you have staples, then you'll need to see either the surgeon, your family doctor, or a nurse to have those staples removed approximately 1 week after surgery and have some steri strips placed over the wound. If the surgery is done laparoscopically or robotically assisted, then you'll have usually between 1, 2, 3, 4, or 1, 2, 3, 4, 5 holes on your belly, on your abdomen. I use 4 holes. Some of my colleagues use 5 holes. All those holes will usually have absorbable sutures that keep them closed with steri strips. The steri strips should not be removed. They should be allowed to lift off themselves, and you can use scissors to trim off the edges. You can shower with either staples or steri strips or absorbable sutures, just to make sure that you're padding dry and you're not aggressively rubbing the area. Certain holes, if you're having a laparoscopic or robotic prostatectomy, may be a little more tender, and the reason for that is some of the bigger holes we have to put in an internal stitch to close them to prevent tissue from herniating out of them, and those stitches sometimes cause a bit of a pinch, so some of the holes may hurt more than others, and that is a very normal thing in terms of the recovery after surgery. The fifth most important thing to know about recovering from radical prostatectomy is when to see your urologist again. Most urologists see their patients within 7 to 21 days after surgery. After that, we usually have the PSA done every 3 months for the first year after surgery, every 6 months from year 2 to 5, and then on an annual basis indefinitely.